Doctors and scientists are recommending October as the best time to get your flu shot. Getting ready for the upcoming respiratory illness season also includes a COVID-19 shot, plus an RSV vaccination is available for older adults and infants. Dr. David Persse, Chief Medical Officer for the City of Houston, is joining me now to help us understand how to reduce the risk of illness this fall and winter. Good morning, Dr. Persse.
Good morning, Haley. Thanks for having me back.
Yeah, so first of all, it is kind of a little bit early in the season. So are you seeing any flu, COVID, RSV cases spiking?
Yeah, good question. And actually right now we're seeing very, very little. As you know, we just came off that COVID wave. We're seeing very, very little, almost no flu right now. RSV, there's a little bit. It's just ticking up a little bit. Levels are still very low, but it is starting to creep up a little bit. So we're keeping a close eye on that. And as you point out, now is, one of the important things to talk about is now is the time for people to think about getting vaccinated as opposed to waiting. Because remember, when you get vaccinated, the vaccine, it takes about 2 weeks before your body has fully responded to it. So you don't want to wait until we're well into the flu season or the COVID season, or what I call the viral season, to get vaccinated. So now is the time. Yeah, absolutely.
Yeah, why is October a good month to do it?
Yeah, so, we see, so between the three viruses that we just talked about, COVID, for example, continues to break the rules, in that it's got a summer wave and a winter wave. We just came off that summer wave. We will probably see COVID come back up in January, February. That's what it's done the last couple of years. Flu is very unpredictable. We've seen it as early as October and as late as May. Generally, it's again in that January, February. But again, like I just said, we've seen it, as early as October. And when we get those years, we get October, November, those years we sometimes see two waves. And then RSV is also a little bit more reliable in November. Well, it's October already, so November is right around the corner. So this is one of the reasons why this is a good time. The levels are low, but we are just about to turn the corner on, all-out viral season.
Yeah, so good time to get the vaccine now so that you're covered through those months where we typically see the spikes. Will you remind people that, there wasn't an RSV vaccine before last year, so remind people that that is available to them now.
Yeah, so RSV, well, a couple of things. One is, you're right, the RSV vaccine is now available and it's relatively new. The other thing is our ability to monitor the wastewater for RSV is also relatively new. So, and then the third thing, RSV is a challenge because when adults get RSV, the symptoms can be really mild. When children get the RSV, the symptoms are severe and the consequences can be dire. And so there's another reason why RSV has been difficult. But yeah, we do now have an RSV vaccine that's available. It's recommended for people 75 years of age and older, because even like the really old adults, they can die from this too. So the vaccine is for people 75 and older, or if you're between 60 and 74, but you've got certain risk factors like chronic heart and lung disease, if you've got a chronically impaired immune system, diabetes, obesity, there are a few other things. And one of the risk factors that puts people between 60 and 74 eligible for it is just living in a nursing home.
Where could people get these shots, and is it okay to get them all at once?
Yeah, great question. So for most folks, if you've got a health plan, perhaps your doctor's office will have it. If not, the local pharmacies. And of course, most of our grocery stores now have got pharmacies in them, so they'll be able to get you those. Now, if your health plan doesn't cover it or your doctor's office doesn't, your local health department can. And so for those of you who live within the city of Houston, you can call 832-393-4220. Or you can visit our webpage at houstonhealth.org, and hopefully we'll be able to answer all your questions there. And if you call that number, 832-393-4220, we'll help you find a place where you can get the shots that's near where you live.
Yeah, and can you get them all at once, or do you have to spread it out?
Yeah. No, you can get them at the same time. What I recommend is my personal recommendation is if you're going to get two of them at the same time, you get one in one arm, one in the other arm. That way, if you have a reaction to it, you know which arm it was in. You can get them both in the same arm, though, and many people choose to do that because then you only have one sore shoulder.
Yeah, I opted for that, and it was pretty sore. But thank you so much, Dr. Persse. I appreciate your time this morning. Always good to see you on a Monday morning.